one of the things I constantly think about is what would our society look like if we had more guys around as fathers, grandfathers, uncles. My paternal grandfather died before I was born. My maternal grandfather, he died, when I was young, and my experiences with my grandmothers were very robust, and so I have so many memories of them, whereas I didn't have those same memories with my grandfather. So what would it be like to have more men around to be able to impart wisdom and, just do those types of things on young men for the next generation?
So the Cutler Center for Men is both a place here at Hoosier, but also a network of providers all across Northeast Ohio. So you can find a primary care provider that's local, that's close to where you live, that's convenient for you. Or if you live near a Hoosier, you can come see your primary care provider right here amongst this outstanding space that was designed specifically to be conducive to men, which is it's really the first of its kind in the country.
Hey John, this is Joe calling from the Cutler Center for Men. How are you today? I just wanted to call and welcome you to the Cutler Center for Men.
The welcome phone call is, really getting to know our members. Do they have a primary care doctor? Do they not have a primary care doctor? Do they live on the east side? Do they live on the west side? We are trying to provide an efficient way to get to healthcare with also providing convenience. The wow moment that we have is we're able to connect with our members via text message, giving them time, date, location of the appointment, provider's name.
So we have an assessment that all men do on the way in to coming, multiple pages, a lot of questions. What are you doing? Are you exercising? What are you eating? Are you, how's your relationships? Are you sad? Are you overusing substances? We can kind of talk to you about that and then also offer you resources and offer you experts in whatever those problems are.
Patients pull up, they're graded by a Joe team member. We are doing face recognition, so we're able to take their picture. We're identifying certain characteristics of that patient, documenting those characteristics, that Mr. Smith is wearing an orange shirt or is sitting in this area of the waiting room. So there's no traditional check-in process. We have some innovative ways that we're going to be able to identify when patients need something such as a cup of coffee or a glass of water, or they just have a general question. Once the patient is ready to be seen in the back by one of our providers, one of our staff members or a Joe member will go ahead and identify where that patient is sitting in the waiting room, making sure that we're escorting them back to the appropriate room, get them ready for their appointment. We continue to connect with our patients routinely, starting off with a simple birthday wish. We send them a birthday text message. But this is a good time to identify annual checkups. Have they seen their provider in that annual year? Do they need anything additional? We continue to send text messaging throughout the year, reminding them that it's Prostate Awareness Month, or Cutler events that may be going on, making sure that they know that we're here for them, and we have a lot of resources available to them.
We really are deliberate about finding the right primary care doctors for the Cutler Center for Men. So we're really looking for primary care doctors that are almost friends with their patients. Their patients are happy to see them, and they know them in a sort of 360-degree way. We're leaning into technology because technology is a train that's running, and it'll leave you if you stay quiet, right?
As urologists, oftentimes we're like the first ones who a guy will come see. So we like to consider ourselves like the gatekeepers of men's health. But we are so limited in what we can offer. I can do a vasectomy, or I can help with certain issues. But there's so much more that goes into a man's health. A primary care physician, financial planning, other aspects that are really, really important to health that maybe the guy wouldn't take the initiative to go out and seek that provider, but since they're here coming in for an issue that they thought they were just going to see a urologist and say, hey, at this facility we also have X, Y, and Z, and you can come back to this same space and have this same type of experience to see those other people. I think it's going to keep them in the system, keep them in the healthcare system, and overall improve their health and their quality of life. The staff we have here is fantastic. It's the cream of the crop. Everyone here, from the people who greet you at the door, the Joes, the nursing staff, everyone here is committed to this goal and this project. Just having that support at every level is going to improve the quality of care, and also as a provider, it's really where you want to be working.
You know, the outside of a hospital can be intimidating. It's like, I don't want to go in there, but if you come in for a different reason, I'm not coming for an exam, I'm coming to listen to some jazz, I'm coming to hear a poet, or I'm coming for whatever reason, then you might come in and see, oh man, this is a really cool space. I can imagine myself seeing a doctor here, or I can imagine myself seeing a clinician here. And so this is a great place to host community events. Again, we're looking forward to welcoming men and women.
But one of the things that I said when I first came in that we wanted to address was really three main things. One was patient education, which is what we do a lot in terms of trying to improve health literacy, removing those barriers to, obtaining a physician or, healthcare testing, and then helping people understand what their healthcare benefits are, and if they're uninsured, helping them get insurance. One of my goals is to bring those resources to the community, specifically the communities that we know are historically underserved, because that's where the biggest gaps are in healthcare.
I signed up with the Joe. There's a Joe, and I love it. I love the Joe, because the Joe keeps me on my toes.
And Joe will set everything up for you. I said, well, wow, that's smart, because that's what guys do. We say, oh yeah, we're gonna go to the doctor, and then we're like, we don't want to make that call. We'd have to set up the appointment, and we go about our day. So I told him, I said, hey, listen, I need a physical. I don't have a doctor. I haven't been to the doctor in 10 years. And then from then on, it was just so easy, because he just does everything, like literally takes care of you, And so for guys that don't want to make a call, it was like a godsend.
After the appointment, Joe comes right back on. Harold, how you doing? How was your appointment? Did we need to talk about anything? Hey, if you got anything, reach out. The piece that I like, that I could go to the place, right? And they've made it so relaxing for us that we can just go, get all of our appointments in, and just sit and just relax. And if the Browns are there getting rehab, we might even get to see one of those through the window that we can look down onto the football field. It's just that appealing and comfortable, and it's not a frightening experience at all. There are so many that may be dying because they don't take care of their health, or they don't watch out for their health. And I believe that we just got to do some more reach out. And now that it's right here in Northeast Ohio, right here in the Cleveland area, we can do that reach out.
I tell all my friends about this. I tell everybody. Anybody I know that says something about a doctor, I'm like, hey man, you might want to check into it if you're anything like me. You're literally going to save people's life, because they're just like me. I mean, literally 10 years. All I do is make one phone call. I didn't have to go and just have this runaround. So it's literally life-changing for anyone who signs up for it.
I mean, I know it's just getting off the ground, but it's going to be big. And I'm excited. I just want to be right in there with it as it gets bigger and bigger. I want us to reach across the United States.